So, pregnancy is a miracle, but sometimes out of reasons which we do not clearly understand, sometimes you might end up losing a pregnancy, thus undergoing a miscarriage or an abortion. So, it is a truth that many people usually face, but only few have the courage to talk about them. So in this video, I'm going to talk about 10 circumstances or 10 reasons or 10 causes of miscarriages and abortions. So the difference between a miscarriage and miscarriage and abortion basically mean the same thing. It is the losing of a baby or termination of a pregnancy. The difference between a miscarriage and an abortion is because an abortion occurs before 20 weeks of pregnancy, while a miscarriage occurs after 20 weeks of pregnancy. So most people usually think that abortions is whereby you find that there's an illegal medical termination of a pregnancy, which is not the case. So in this video, we're going to talk about the 10 circumstances or the 10 things which might cause you to lose your baby, which might cause you to get a miscarriage or get an abortion. So this video is for informational purposes only. Before we go to the video, you need to understand that this video is for informational purposes only. It does not substitute medical advice, but rather complements medical advice that you are given by your doctor or your medical practitioner. So welcome to my channel. My name is Maxwell Wabwire. In this channel, we talk about different medical topics. If you like such kind of content or such kind of information, please remember to subscribe. So let's get started to the video of today.
I be so sick of you niggas, y'all contradict me. I be so bold myself when you come and fuck me. I feel so ordinary, except when you around me. Treat me like water while you play me out. Arguments, you air me out. Tripping about you.
Welcome again. So the number one cause of miscarriages and abortions is because of chromosomal abnormalities. So we have said that abortions is whereby there is a termination of pregnancy before 20 weeks, while miscarriages is whereby there is a termination of pregnancy after the lapse of 20 weeks. So you need to understand that before we get started, we go deeper to the explanation of the video of today. So the first cause you say it is because of chromosomal abnormalities. So human beings usually have 46 chromosomes, whereby you get 23 chromosomes comes from your mother, while the other 23 chromosomes comes from your father. So the sperms usually have 23 chromosomes, while the ova usually have 23 chromosomes. So when you add these two, you will find that you'll get 46 chromosomes. So sometimes because of chromosomal abnormalities, you might find that the fetus ends up having more than 46 chromosomes, or having less than 46 chromosomes. So this will interfere with the development of the fetus, and most of these fetus or the babies who end up having abnormal chromosomes usually end up in miscarriages and abortions. The number two cause of abortions and miscarriages is because of placental problems. The placental problems. So when you get pregnant, the placenta is the organ that links your baby and the mother. You need to know that the mother's blood and the baby's blood do not usually mix. The baby usually gets the nutrients and oxygen from the mother through the placenta. So when you have abnormalities in the placenta, you might find that the baby might lack the nutrients, or they might lack the oxygen, which are important for their survival. So any issues you have with the when you have abnormalities of the placenta, this will result to miscarriages and abortions. Number three, we have maternal age. So maternal age is a factor in miscarriages and abortions because the higher the age of the mother, the higher the chances of abortions and miscarriages. So this is because women are usually born with the total numbers of eggs they will have in their lifetime. Yes, women usually are born with all the eggs you will use in your lifetime. You are always born with the eggs. Unlike men, men are usually born, then they start generating sperms. Yes, men usually generate new sperms each and every day, but women are usually born with the total number of eggs they will need in their lifetime. So the higher the age, the more you are risk of getting abortions and miscarriages because uh, of the increase in the age of the eggs. So the more the age of your eggs, the more there is an increase of the chances of them having chromosomal abnormalities, especially for women who are 35 years of age and above. They tend to have higher chances of getting abortions and miscarriages. So it is advisable that you get kids at a lower age, between the legal age, which is 18 in Kenya. In the US, the legal age is 16 years. So it is advisable that you get your kids uh, while you are still younger, because by the time you hit 35 years, you tend to have more cases of abortions and miscarriages. Number four is because of having uterine abnormalities. The uterine abnormalities. So the uterus is your womb, is the place whereby your baby grows. So sometimes you might find that because of having abnormal uterus, this can be because of you having abnormal shape of the uterus, or sometimes you might have fibroids in your uterus, or sometimes there is development of a septum, something that divides your uterus. So all of this will interfere with the viability of the pregnancy, which will end up leading to miscarriages and abortions. So abnormal uterus will interfere with the growth of the fetus, because if it is in a bad shape, or if you are having the fibroids, it might put pressure on the developing fetus, which will interfere with its growth, thus leading to a miscarriage or an abortion. Number five is because of an incomplete cervix or abnormalities of the cervix. So the cervix is the neck of the womb. The cervix is the neck of the womb. So this is the place whereby this is the place, this is the organ that separates the womb and the vagina. So during pregnancy, at the moment they fertilized the fetus or your baby, your fetus sticks itself at the womb and starts growing. Your cervix usually closes up. So it closes up so that it can prevent interference from either outside, and protects outside the body through the vagina, and this protects your pregnancy. It helps you to minimize the entrance of other things, other diseases and pathogens that might go to the uterus and which will affect your baby. So sometimes, because of abnormalities of the cervix, you might find that the cervix might open up too early. So when the cervix opens up too early, because it is something that is protecting and holding your baby, you might find that you will lose this pregnancy because of the opening of the cervix. The number six cause of miscarriages and abortions is because of hormonal imbalance. Yes, hormonal imbalance. So hormones are usually essential things which usually support your pregnancy. So any issues with the productions of hormones will interfere with the viability of your pregnancy. So we have conditions such as hyperthyroidism or hypothyroidism. This is whereby you find that your thyroid glands usually are overfunctioning, or either they are malfunctioning, which will interfere with the production of different hormones which support pregnancies. We have conditions such as polycystic ovarian syndrome. This is also another condition that usually affect the production of the progesterone and estrogen hormones, which will interfere with the growth of your baby. So hormones are essential or are important things or are important supplements, or they are important things which support your pregnancy. So any abnormality in the production of these hormones will lead to miscarriages and abortions. The other thing, or number seven, we have infections. Yes, we have infections, and this is whereby you need to put a lot of concentration. This is whereby you need to know about. We have many infections which cause miscarriages and abortions. We have infections such as toxoplasmosis, we have cytomegalovirus, we have gonorrhea, we have many untreated sexually transmitted infections and urinary tract infections, the UTIs and the STIs. When you do not treat these diseases and infections, at the end of the day, they will lead to abortions and miscarriages. So that is whereby you need to get necessary treatments in case you're having these kinds of infections, more specifically when you are pregnant, because these infections usually lead to pregnancy loss. Number eight, we have chronic maternal health conditions. Chronic maternal health conditions. Some chronic A chronic condition is a disease, is a long term diseases. We have example of these diseases include asthma, we have hypertension, we have diabetes. These are diseases, or these are conditions which usually call them long-term illnesses. So chronic medical conditions including hypertension, which is high blood pressure, uh, conditions such as diabetes, uncontrolled blood sugars. These conditions will lead to abortions and miscarriages. This is whereby you need. This is why when you have these conditions, most of the time when you are pregnant, you will need to be admitted to the hospital so that you can be constantly get checked and get monitored of your blood sugars, and also to get monitored about your blood pressures, because these two might lead to abortions and miscarriages. We also have severe kidney diseases. We also have anemias and malaria, malaria. This is why when you are pregnant, you are usually given malaria prophylaxis. For us in Kenya and in Africa, whereby we have abundant mosquitoes and abundant too much malaria. So it is important for you to take the malaria medications, because malaria is a leading cause of abortions and miscarriages, especially in Kenya and especially in regions which have high populations of mosquitoes and high population. We call them the endemic regions. So this is why uh, we usually put emphasis that you should take your anti-malarial medication when you are pregnant. This is also why when you get pregnant and when you go to the clinic, you are usually given a mosquito net. Yes, you are not usually given that so that you can go and use it to rear your chicken or just because you are pregnant. Some people might think that this is just a gift they are being given because they are pregnant. No, this is something they give you because we know malaria is a leading cause of miscarriages and abortions, which is something we want to prevent and we want to avoid in pregnant mothers, because it is usually painful to lose a baby. That is the lowest moment a woman can get. So it is important for us to eradicate these diseases which I've mentioned here, so that we might minimize getting abortions and miscarriages. The number nine condition, we have autoimmune disorders. Autoimmune disorders. So this is whereby you find that the mother's immune system attacks the baby. So our immune system are usually meant to protect us against getting pathogens and infections. So these are the things which our immune system are meant to attack. So sometimes you might find that the immune system attack the baby. So when the immune system react against the baby, we'll find that you might end up losing the baby. We have conditions such as lupus. We have another condition whereby we have the rhesus factor, whereby the mother's antibodies attack the rhesus antigens in the baby's blood. So this usually occurs whereby you find that the mother has a rhesus negative blood type, and the father has a rhesus positive blood type. So the baby will end up having a rhesus positive blood type. So because the mother does not have these rhesus antigens, the body of the mother will identify the rhesus of the baby as being foreign. So they will attack the babies. So at the end of the day, you might get miscarriages or constant miscarriages. Most of the time you'll find that the firstborns of the first children usually are not usually attacked by the immune system, because at this point the mother's blood is getting fast exposure of the antigens, so it does not form sufficient antibodies which attack the first children. But other subsequent children, you'll find that you might end up getting abortions because of having autoimmune attacks of the baby. Finally, we have number 10, we have lifestyle factors. Lifestyle factors. So basically, lifestyle is our way of living. So lifestyle factors such as smoking, drinking excessive alcohol, uh, taking illicit brews, abusing of drugs, illegal drugs such as heroin, cocaine. Most of these drugs usually cause abortions and miscarriages. So this is why when you get pregnant, you need to avoid smoking and also avoid taking alcohol and also taking other drugs and other illegal drugs. So alcohol and smoking usually affect the development of the baby. When you are smoking and when you are drinking alcohol, you are being unfair to a baby because you are interfering with the development of your baby, and the baby might end up having developmental abnormalities, including the development of the baby's brain. So it is important that when you are pregnant, you need to avoid taking alcohol and you need to avoid taking smoking. Apart from that, these lifestyle factors which I've talked about also might lead to abortions and miscarriages. So, with that said, we have talked about the 10 things that can cause miscarriages and abortions. So, with that said, I've come to the end of my video. Unless you have any questions or any concern, let me know down in the comment section below. So, with that said, bye bye for now. Let's meet in my next video. I hope you have enjoyed my video. So bye bye. Let's meet in my next video.